Welcome to the Global Addiction Therapeutics Innovation Day.
Now we can start the first panel. And in our first panel, we will have Anya, Sanita, Erin, and Anton as our keynote speakers. So they can join us here. We need to just make sure about the arrangement of the panel, but yeah. Thank you very much. One of the fundamental aspects of what we have here in this meeting is just being able to bring industry-academia partnership. And I should thank our colleagues from industry who are here. So colleagues from Sinray, Indivior, Ethifarm, Spark, and Salofa that have been kind of contributing significantly to what we are doing here. They will have talks, they will have discussions. So I'm hopeful that we'll have further industry collaboration. And we started the idea of Innovation Day in Istanbul, something like 7 months ago. We had a meeting, we invited all the key players in the field, and we had the first meeting, and we started from that point, developed the initial web page of Innovation Day, and then we started to identify areas of innovation, and we have been discussing about 10 main areas of innovation, and we started to communicate with all the companies, all the teams that are working in these 10 main areas of innovation, from digital health, pharmacological interventions, and even to integrated care models and workforce training. So we started with the initial idea and kind of invited over 300 different companies and teams around the world to be a part of this meeting. So the panels that we are going to have today, we start with the first panel discussing about global needs for innovation. And the list of speakers that we have speakers from WHO, from UNODC, from UK Life Sciences Office, and also from people with kind of lived experience of substance use, and discussing about how we can do the innovation, what are the needs that we have in the field. Then we will have a panel on innovations in molecular targets, a specific panel afterwards on innovation for circuit and behavioral targets, and then the last panel will be industry-academia partnership with the speakers on that panel. We have a specific panel for industry talks, and we have another panel with innovation award competition. So that's going to be the arrangement of the meeting today, and we'll have those discussions here today. Fantastic list of speakers, innovation award that we'll discuss. And also, we have already confirmed the plans for having Innovation Day in 2026 in Rotterdam, and it's going to happen in September 30th next year. So, I mean, just mark your calendar, that is going to be the next step, and we'll have the same patterns of things in that meeting. At the end of the meeting, we are going to share a link to feedbacks and comments. So please write down whatever, I mean, this is the first time that we are running this Innovation Day. Make a list of the things that you liked about this meeting and the things that you didn't like about this meeting and how we need to change those things. So we are going to share a link and we are going to receive your feedback and optimize the meeting afterwards together. We had lots of meetings with different people who have been kind of working together, several online meetings, and I'm really happy that we are here. So just few kind of ideas about what we are discussing. One of the areas of innovation that we have is basically neuromodulation technologies. We will have multiple talks today discussing about neuromodulation technologies. Different neuromodulation technologies are going to be a part of addiction treatment in the future. And just to give you a sense about two of these technologies, what we call TMS and TES, transcranial magnetic stimulation and transcranial electrical stimulation. The number of studies with these technologies is just increasing over time significantly. And there are already FDA approval or clearances for TMS, those who are informed about what we have in the field. And as you probably heard, we already have one specific FDA approval for smoking cessations using transcranial magnetic stimulation. And there are ongoing efforts to bring new FDA approvals for using brain stimulation technologies to addiction medicine. So that is definitely an area of innovation that we'll further discuss about, and there are interesting things that are happening specifically in this field. We have a specific CE approval in the field of addiction for using TMS. Does anybody know that that CE approval is about what type of drug addiction? CE approval for using TMS technology for addiction treatment here in Europe. Okay, so that is assigned for psychoactive substance use disorder, which is basically, I mean, the label is very general, so kind of all the substance use disorder could be included there. But the evidence is from the 2 studies from cocaine use disorder that made it possible for having that specific CE approval for addiction treatment here in Europe. So there are definitely innovations that are happening on that area of medicine. There is a new paper in American Journal of Psychiatry just a few weeks ago discussing about treatment of comorbid depression, anxiety, OCD, other things with substance use disorder with brain stimulation technology. So, I mean, those even comorbid disorder interventions are definitely going to be important. The number of trials that we have with electrical stimulation and magnetic stimulation is increasing over time. So we have over 242 trials that people have done so far using magnetic and electrical stimulation in the field of addiction medicine. So the field is exploding in terms of number of studies and what people are doing, and targeting different brain areas, different technologies, different brain areas. And while probably in the field of depression, brain stimulation is finding the right biomarker for targeting. So we know that in the field of TMS, now people are realizing for treatment of depression, they can target DLPFC, and it's a common practice that we are doing the daily clinical work, doing TMS for depression, and finding the connection between DLPFC and subgenual cingulate cortex as a biomarker. And there are even companies that they are patenting those specific connectivity patterns to individually target brain for depression. And the question is, what would be the right target for addiction? And there are definitely discussion in terms of specific brain circuits in the brain that can be targeted for addiction therapeutics. We know that in craving state, there are specific activations in the brain regarding having default mode network going up, executive control network going down, and the balance between them that could be optimized to reduce drug craving. So how these targets could be used specifically for addiction therapeutics, these are interesting discussions that are happening in the field. Now there is what we call a dual target model for addiction therapeutics, specifically trying to dampen limbic cortex and default mode network with targeting frontopolar cortex, and also increasing activation in executive control network with targeting dorsolateral prefrontal cortex. And this is a model that people are investing further on that. And this is what we try to do, even using robotic arms to be able to individually target those areas that are important for addiction therapeutics. So there are lots of interesting discussions. And during the conference, starting from Monday to Wednesday, we'll have multiple panels discussing about these innovations. We'll have a panel with Dr. Wei Hao discussing about the specific circuits of kind of brain therapeutics that using those technologies, and how we can do what we call precision dual targeting for addiction therapeutics. And a recent meta-analysis that we have done, we showed that there are multiple different protocols for stimulating brain that they have evidence that they can be used in addiction therapeutics. And all these different protocols, they are targeting frontopolar cortex eventually, or dorsolateral prefrontal cortex as the main targets for addiction therapeutics, and we'll discuss further about them. And not only the innovative circuit-based targets, but also molecular targets in the field. If you look into the number of new innovations that we have for molecular targets, only for opioid use disorder, there are over 120 different new molecular targets that people are using. From the substance use targeting agents that we'll discuss further today, from the targets that are basically receptors in the brain and the specific molecules that they are targeting those receptors in the brain, transporters, different sort of norepinephrine and dopamine transporters, and also channels that are being targeted for addiction therapeutics, and also enzymes. These are just over 120 different molecular targets specifically only for opioid use disorder. So there are many innovative things that are happening. Sometimes medical students ask me in terms of, is addiction medicine exciting enough for a new generation of people? While, AI, all those things are happening. There are lots of really cool things happening in addiction medicine. Only just the molecular targets for addiction, for opioid addiction, over 120 different molecular targets that are being discussed, and people are working on that. And there are really multiple companies just on mu opioid receptors. These are the companies that we have in the field that are targeting just mu opioid receptors. And then for 5-HT receptors, for kappa opioid receptors, for orexin, for alpha-adrenergic receptors, dopamine receptors, ion channels. So there are multiple companies for every single area that you are thinking about, just to be able to develop new therapeutics. So there are lots of innovations that are happening in the field that makes things very exciting in the future.
Organized by International Society of Addiction Medicine, sponsors and co-organizers, CNRE, Indivir, Spark Biomedical, Salofa, Ethifarm, University of Minnesota, European Union Drugs Agency, UK Office for Life Sciences,